Hey there. Ever heard of Piriformis Syndrome? It's a condition where the piriformis muscle in your buttock irritates or compresses the sciatic nerve. This can cause pain, numbness, and tingling in your buttock, hip, and leg. Sounds uncomfortable, right? Let's dive into what causes it and how you can find relief. Piriformis syndrome often flares up with activities like sitting for long periods, climbing stairs, or running. If you're experiencing these symptoms, it's crucial to get a proper diagnosis. Doctors usually rely on your symptoms and a physical examination. Sometimes they might use imaging tests like MRI or X-ray to rule out other conditions. Now let's talk treatment. The first line of defense includes rest, ice, and heat therapy. Over-the-counter pain relievers and muscle relaxants can also help manage the discomfort. Physical therapy is another effective option, focusing on stretching and strengthening exercises to relieve pressure on the sciatic nerve. In some cases, injections might be necessary to reduce inflammation and alleviate pain, and in rare situations, surgery might be considered to release the pressure on the sciatic nerve. But don't worry, that's usually a last resort. Recovery from piriformis syndrome varies from person to person. It's essential to follow your doctor's advice and stick to your treatment plan. Gradually, you'll notice improvements and get back to your regular activities without pain. Remember, if you're experiencing persistent pain in your buttock or leg, see a doctor to get a proper diagnosis and discuss the best treatment options for you. Taking the right steps can make a world of difference in your recovery. Thanks for tuning in. Stay healthy and take care. And don't forget to check out mdsearchlight.com for more health tips and information. MD Searchlight. Be your own advocate.